I'm here today to talk to you about abnormal vaginal discharge. Many times when one goes to their physician, this is handled very quickly and easily with some basic testing. Occasionally, this goes on too long, and in spite of treatment, people will have symptoms come back, or they'll continue to have symptoms. What's very important is that you make sure you go back and talk to your doctor again. There are many tests to find out what's going on with these sorts of problems, and a few women are going to need some special testing or different testing than was done originally to help make sure they understand what's really going on. So the bottom line is, make sure you talk to your doctor, make sure if you continue having symptoms that you go back, because they may get new tests. Prevention of cervical cancer in women is a very important topic, and fortunately we are getting better and better at what we do to prevent cervical cancer. There's two important things that every woman needs to know. The first is that HPV vaccination clearly prevents cervical cancer. In countries around the world with high vaccination rates, we find not only a high degree of safety, but we also see tremendous drops in the abnormal Pap test that we find and abnormal cells that we find on the cervix. So it is both safe and effective, and if you are of appropriate age, or if you have a daughter or a son that's at appropriate age, we strongly recommend that they get HPV vaccinated. However, we still also need to screen people. So if you are a woman, especially if you are of reproductive age or older, it's important that you get screened for cervical cancer. In the United States, we're changing how we approach cervical cancer. We look things now at the risk of forming cancer over time, which is helping us do a better and better job of tailoring the specific treatment or follow-up to every single patient and to the conditions that they have. This gives them the best outcomes at the lowest risks of cancer.